Welcome back to Toledo Clinic TV. My guest for this segment is Martha Graham. She's a physical therapist, but she's here today to talk about metacupping. And this is something that gained a lot of attention during the Olympics when Michael Phelps showed up and had what many people thought were bruises or welts on him. Explain what it is exactly.
What cupping is exactly, it's a negative pressure therapy. So we use a suction instead of pressure to get our desired result in the tissue, whether that's a lymphatic drainage or working with scar tissue. In Michael Phelps' case, they were working on scar tissue and to also decrease the stagnation from all of his training. So you do get a light bruising under the cup, but most of it is actually old debris from all of his training and tear down in the muscles that's getting pulled to the surface, and then the lymphatic system can take it away and the body can process it out.
And get rid of all those toxins.
Correct.
So who might be a candidate for cupping?
Most people are a candidate for cupping because it increases lymphatic flow. Most of us need help with that, so it's healthy for a lot of us. Scar tissue from post-surgical is another good reason people get cupping done, and it helps decrease pain. It sedates the nerves. So if you have somebody with a really flared up back, we can do a little bit of light cupping and decrease their pain right in that session.
And you said you have a machine that does it, but then you also can do some of it manually. Explain how that works.
Correct. I have a machine that creates the negative pressure, which gives me a lot of control. I can put the machine on a pulse. I can control the level of suction. So people are afraid of cupping because they think we're just going to put a cup on them. It's going to have a lot of suction and it's going to be painful. It's not. And then I also have soft silicone cups to get on areas that might be bony, more sensitive, and I can have the patient move while those cups are on to do stretches.
And how long do the effects last? You said it offers some pain relief and helps get those toxins out. How often would you need to repeat the procedure?
Usually the pain relief lasts for a few hours, and then physical therapy, we add the exercise to it to correct the dysfunction, to give you even more pain release and correct the problem. The lymphatic drainage, that continues to improve as you move more. Some people will do it for a maintenance and come in once a week, once a month, but in a physical therapy setting, we tend to do it twice a week at maximum over usually about 4 to 6 weeks.
And this is something that many insurance companies will cover, but you can also just pay out of pocket to have it done.
Correct. As long as it's integrated with your physical therapy plan, the insurance company will pay for it. You can also come in and pay out of pocket for it in the office.
And is it expensive?
No, it's not expensive at all. A 15-minute session is $18, and they go up from there to $70 for an hour.
And you might have this done how often?
Twice a week is the maximum. I see a lot of people getting a lot of benefit initially at once a week.
Okay, but anything more than that would not happen?
No.
It would be harmful.
It's too much for the body to process out, and people get flu-like symptoms, aches, pains, and it's really counterproductive to what we're trying to do with the cupping.
And so, again, who might be a candidate for this? If I came into you and I said, for instance, I'm having some back pain, that would make me a candidate?
That would definitely make you a candidate for it.
Okay. Thank you so much. Very good information.
Thank you.
And we'll be right back.